there any other comments? Senator Fumo.
Thank you, Madam President. Madam President, I'm going to vote for 489, but I also voted for Senator Hughes' amendment. And during that debate over his amendment, I listened to a lot of interesting things being said on this floor. I heard us say from the other side of the aisle that health care for all was a worthwhile cause, but this just wasn't the appropriate time. I also heard that there's a long list of programs that should be considered from Senator Corman to help out with that. But, Madam President, while I heard many, many things being said, I didn't really see any action to help the 800,000 plus people without health care. We're about to break for Christmas. We're going to go home to our homes, to our families, and enjoy Christmas without the fear that if something happens to ourselves or to one of the ones in our family, that we won't be able to take care of them health-wise. Because we do have good health care here in the Senate. We're going to go home for Christmas and not worry about this because it's not yet the appropriate time. I asked my colleagues to go back and ask the 800,000 people when they think the appropriate time might be. Madam President, this is not just an issue that affects the working poor in Pennsylvania, although it does, but health care is now an issue that affects the working class. People with insurance are afraid of losing their insurance. And they're more afraid than the people who I assume have just about given up among the working poor. The actual poor have Medicaid to take care of them, and the rich don't worry about it. Madam President, I ask, when is the appropriate time? We did pass a 25-cent per pack cigarette tax to bail out the doctors, who are among, I think, on just about every survey, the most affluent of our citizens. Nobody wants to beat up on doctors. But the intent for those people watching on C-SPAN tonight, or excuse me, on PCN, who don't really understand what's going on here, the intent of Senator Hughes' amendment was to get leverage, to make this chamber get up and do something. There were 14 votes for that leverage, 12 short of the necessary number to do something about the problem. Madam President, I was told a story a long time ago, and Senator Stout's not here tonight. He's usually the one to tell these kinds of things, but former House Speaker Bob O'Donnell once explained to me the difference between being for someone or something, we're all for health care for everybody, and being committed to that. Tonight we saw that there are 14 people committed. The rest are just for it. And the analogy he used was ham and eggs. When you look at that order of ham and eggs, the chicken's for it, but the pig is committed. Madam President, we've got to get that number of 14 up to 26. And we're too busy rushing home for Christmas vacation to do that. We're all for it, but not many are committed. We then say to ourselves, gee, when did this idea first come up? And there's obvious issues with the governor's plan. I've had some with it as well. But he brought it to the agenda in his inaugural speech, and he raised it again in his budget message. And yet we went around here for months and months and months of doing nothing but coming in and voting on adjournment motions, naming roads, any kind of cockamamie thing you can think of, but nothing productive. when the average guy out there, Joe Sixpack, or I forget exactly how Senator Wozniak refers to his ethnic group, but when they see that, they start to wonder, what am I going to do this Christmas about health care? Where are my senators? Why aren't they worrying about me? There wasn't enough time to do this. We didn't have enough time to study this. This, for many of these people, is a matter of life and death. It should be our number one priority. But we sat around week after week, doing nothing, collecting per diems, so we can enrich ourselves, going home, using our health care for ourselves and our kids and our families, while these 800,000 people wonder when the appropriate time will come. Madam President, tonight was a chance to try and get some leverage over the situation so we could take some of those chickens and make them into pigs. In this case, good pigs. Pigs that want to do something for humanity. But instead, we still got a lot of chickens scared to death, running away from the problem. We're worried about taxes. Why don't we vote a 10-cent per pack cigarette tax for these 800,000 people so they can get health care? We voted 25 cents for the richest among us. Can't we vote 10 cents for those that are struggling? And I'm not talking about the ones that are looked down upon by some people on the other side of the aisle, the welfare recipients. I'm talking about people working at those hamburger flipper jobs because that's all they got, and going home without health care. I'm talking about the working poor. And I'm also talking about the middle class who's scared to death that they're only a day away from the working poor. But yet, it's a worthy cause, but not the appropriate time. And we'll adjourn for Christmas vacation. I ask you, when you're opening up your Christmas presents or playing Santa Claus or bringing good to your kids and your family, to take 30 seconds, that's all I want, 30 seconds, and think about the working poor that don't even have the very basic human dignity of having health care. Madam President, that's what Senator Hughes' amendment was about. It wasn't about anything else. It was about getting leverage and making some of the chickens into pigs. That's all it was about. Madam President, hopefully soon, maybe after Christmas vacation, before Valentine's Day, we might have the appropriate time to worry about those 800,000 plus people who are working every day and don't have health care. Now, I don't care how we get there. I don't care which one of the list we get from Senator Corman or anybody else, or if it has something to do with the blues. But maybe by Valentine's Day, we can have a heart and do something for those 850,000 people. Now, that might require that we come back here and work. That might require that we come back here and earn our per diems, rather than run in, run out, adjourn, name another road after somebody, name another park after somebody, and get out of Dodge and then say, gee, it's too late. We don't have enough time. So my plea tonight is that while we go home for Christmas, we set Valentine's Day as the appropriate time to do something about this worthwhile cause, whatever it is. And the 14 of us that voted tonight are more than willing to work with the rest of you to find a compromise to help out those 800,000 plus people who are suffering today in this prosperous Commonwealth. Thank you, Madam President.